Hi everyone, welcome back. We're at Championship Chiropractic with Dr. Ozello. We're going to talk all about your hip flexors today. Dr. Ozello, what are the hip flexors?
The hip flexors are the large muscles located in the anterior aspect of the hip. Anterior is the medical term for the front. These are the muscles that when contracted concentrically, they flex the hip. Hip flexion is bringing the thigh and the knee closer to the chest. These are big, strong, powerful muscles, and they originate on the spine. And then part of it attaches to the pelvis, and then another muscle originates on the front of the pelvis, and both of those muscles run down and attach to the inside part of the femur, which is the medical name for the thigh bone. So if there is tightness in the hip flexor muscles, that can contribute to pain and symptoms in the low back, in the pelvis, and in the hips.
So, hip flexor tightness can contribute to lower back pain?
Yes. First of all, because that's where it originates from, and that's where the psoas muscle originates at. It's on the side of the lumbar spine on both sides, obviously. And so if there's tightness in that muscle, it can contribute to low back pain and symptoms.
So, can a chiropractor help with your hip flexors and lower back pain?
Oh, definitely, definitely. What I would do is I look at the whole general area. You're looking at the lumbar spine, the pelvis, and the hips. So we want to make sure everything is functioning well. So there may be a chiropractic adjustment performed to the lumbar spine, to the sacroiliac joints, and to the hip joints, and then do some muscle work on the hip flexor muscles to reduce the tension in that area.
All right, that's great. So I come see you. You help me with my lower back pain by adjusting my hip flexors. When I go home, are there things I can do to make sure I keep them healthy?
Oh, definitely, definitely. One of the main things is two of the main things are foam rolling and stretching the hip flexor muscles. Stretching the hip flexor muscles is vital. Like I said, those are big, strong, powerful muscles, and they're often stronger than the muscles that performs the opposite motion, which are the gluteus maximus and the hamstrings. They perform hip extension. So the hip flexor muscles, you can perform slow, static stretches for the hip flexor muscles, move into the stretch slowly, hold a mild, comfortable stretch, and then move out of the stretch slowly.
And you want to move slowly because it's such a big, powerful muscle.
Well, you want to move slowly, first of all, because if you move too fast, it may cause certain muscles to tighten, and you're trying to stretch. So you want to keep the muscles as relaxed as possible when you're stretching.
So when you're at home, move nice and slow. Take it easy. Dr. Ozello knows what he's talking about. Thanks for being here.
Thank you, James. Thank you, everyone.
Thank you, everybody, for watching today's video on spine health. If you have questions, feedback, or suggestions, you can leave them in the comment section below. Please feel free to like this video, and please subscribe to my YouTube page, Dr. Donald A. Ozello, DC. You can also visit my website, championshipchiropractic.com, where you can see my blog, which contains articles on sports medicine, chiropractic, health, fitness, and nutrition. Thanks again for watching today's video.